Hi YouTubers! Thank you so much for clicking on this video. I hope you are well and excited to learn something new. Today's video we'll be covering frequently asked questions specific to cryptic pregnancy. I did cover a lot of these questions in my live Q&A on Facebook, but I decided that these questions are so often asked that it would be wise to cover these questions in a video specific for YouTube. So for the sake of time, let's dive right in. The first question, is cryptic pregnancy real? A real cryptic pregnancy is when a woman doesn't find out she's pregnant until she is 20 weeks or more. The woman produces little to slow rising HCG, and so the pregnancy can go undetected for months and can possibly even go unconfirmed the entire 9 months until the woman delivers. It is possible for the expecting mother to continue to have what she interprets as a monthly cycle during the 40-week gestation period. Because this question did not specifically ask if I thought that an extended gestational cryptic pregnancy was real, for the sake of time, I will just go ahead and skip over that. The only thing that I am acknowledging that is real is a cryptic pregnancy when a mother has a 40-week gestation pregnancy and doesn't know about it and goes in it's either confirmed after 5 months, 20 weeks or more. Next question. If this is not a cryptic pregnancy that I'm experiencing, then what else could it be? And the answer to this question could be very complex and could even take weeks and months to find. Depending on your symptoms and how often and for how long you've been experiencing them, it could be a pregnancy induced by thoughts of wanting to be pregnant or fear of being pregnant. You could be experiencing toxin overload, digestive issues, lymphatic problems, nutrient deficiency, hormone imbalance, or a combination of all of these or some of these. Healing takes time. This is very important to remember, that healing takes time. These are just a few ideas and options for alternative therapies besides committing yourself to a 2 to 5 year pregnancy, because you do not have to commit yourself to a 2 to 5 year pregnancy if you do not want to. Next question. How long can a pregnancy really last? The answer to this question is some women have been known to progress healthily in a pregnancy beyond 45 weeks gestation and go on to deliver a healthy baby at 46 to 48 weeks gestation. It is important to note that these women are highly monitored by a doctor or midwife to ensure the safety of both mother and baby in prolonging labor. Next question. Was Jackie Chan really a 12-month gestation? Answer. I cannot find many details on the case of Jackie Chan except that he was 12 months at birth and had to be surgically removed. The fact that very little details surround the validity of this claim that his mother was in fact pregnant with him for the full 12 months is curious. But it is important to note that he was born at 12 pounds, which suggests that he was of normal growth rate in utero and went overweight in the womb due to being a post-term infant. So Jackie Chan was not a cryptic pregnancy as defined by the Cryptic Pregnancy Support Group. There is also a story of a woman in a prison war camp who allegedly waited until the camp was liberated to give birth at 12 months gestation. I've only found medical cases and medical documents supporting a pregnancy that goes up to 12 months gestation. Anything longer is not supported in medical journals, medical literature, scientific, and there's nothing supported after 12 months gestation. But it is important to note that maybe these claims are not so odd when you remember that the average pregnancy is actually nearer to 10 months than 9. So if you give birth at 43 weeks, which isn't that unusual, you are heading towards 11 months anyway. So if you look at it like that, it's not very strange. Next question. Why is a cryptic pregnancy, labor, and delivery explained to be longer and more painful? This is a very important question. And the answer to this is, I'm not sure why this particular detail has been made up by the cryptic pregnancy community. Dilating and effacing are done the same way. You do not dilate or efface any different in a cryptic pregnancy than in a standard pregnancy. Labor and delivery for cryptic pregnancy being longer and more painful is just a myth, and it's just something that's made up. It has absolutely no scientific backing or medical backing that a cryptic pregnancy is more painful or longer. Next question. Can you be in active labor for over 24 hours, your water breaks, baby's head descends into your vaginal canal, and then all of a sudden labor stops completely and the baby goes back up and the amniotic fluid fills back up to continue the pregnancy for weeks, months, or years? The answer to this is no. This is physiologically, physically, and anthropologically impossible. A human baby would die if it was not born within a certain time frame after the waters break. The body does not have the ability to push a baby back up into the uterus to continue the pregnancy. Your body is physically made to push stuff out, not made to push stuff back in. Your body does not have the ability to pull a baby back up, repair the amniotic sac, refill the amniotic fluid, and then continue the pregnancy. This is why premature births occur even when medically prevented. Your body has no ability to pull a baby back up and do those things to continue the pregnancy. Next question. Can a baby really grow tucked against the spine in utero? Answer is yes. It's called having a posterior baby. It is known that the position of your baby can change throughout your pregnancy as your body and your baby prepare for birth. There are ways of manually changing baby's position from the outside, and even ways of encouraging baby to change position as your due date approaches. So the chance of a baby staying in a posterior position throughout the entire pregnancy is possible but very unlikely. Next question. How safe is an at-home labor and delivery? How safe is an at-home birth? This is a very great question for the cryptic pregnancy community because they are told they will ultimately have to deliver at home without any medical assistance, regardless of their pregnancy symptoms, labor symptoms, and possible delivery complications. The simple answer as to whether or not an at-home birth is safe depends entirely on whether or not the at-home birth is planned. A planned home birth can be very safely performed when the baby is being monitored by a qualified midwife or nurse midwife during labor and delivery. The pregnancy is low risk without any complications or development of disease during pregnancy. The baby is in a head-first position confirmed by a doctor or midwife, and the pregnancy is between 37 to 41 weeks pregnant. It is important to note that if the mother herself has thoroughly researched labor and delivery at-home procedures and is comfortable enough to take on the liability, she does have the option to perform her own delivery without any medical intervention. This endeavor comes with great responsibility for both mother and baby prior, during, and after delivery. It is understood that every and all at-home births are subject to possible complications just like any other birth, and have been higher risk. There have been higher risk of complications having a negative outcome due to being away from available emergency care that the hospital itself provides during hospital births. It is the distance that creates the higher risk of a negative outcome and not the at-home birth itself. The availability of emergency care quickly is what raises the risk to both mother and baby, and it is up to the mother to decide whether or not she wants to take this risk on for both her health and the health of her baby. Next question. Will I really need to deliver at home as a cryptically pregnant mother? The answer to this, and this is a very interesting question, because in the cryptic pregnancy community, you are told that you will need to deliver at home and that there is no other option because the doctors will not believe you. You do not have to deliver at home as a cryptically pregnant woman if you do not want to. Although the cryptic pregnancy community would like for you to think otherwise, as a cryptically pregnant woman, you do not have to deliver at home. You do not have to deliver your own baby without any medical assistance, and you do not have to go without prenatal care for your entire pregnancy. This is a cryptic pregnancy myth that you will have to deliver your own baby at home and you will be denied prenatal care and ultrasound due to low HCG. Again, this is a myth. You have the right to a hospital delivery. You have the right to receive prenatal care. You have the right to speak with any and all available doctors and specialists about your current pregnancy and about your unborn baby's health. You have the right to fetal diagnosis and treatment. Your baby has the right to fetal diagnosis and treatment. Your baby has the right to a safe and appropriate delivery and care after birth. Your baby has the right to be born in a hospital. You have rights. And with this, you are able to deliver wherever you would like as long as it follows your state laws. So research your individual state laws on unassisted childbirth and at-home birth to get details on what is legal in your particular state. Again, as a cryptically pregnant woman, you are not required to deliver at home. You have the right to deliver your baby wherever and in whatever situation you find appropriate, as long as it is legal and does not put you or your unborn child's life at stake. Please research your individual rights as a citizen and mother in order to avoid believing in myths presented and recycled in the cryptic pregnancy community. It is illegal for a doctor or hospital to refuse prenatal care to a woman who is confirmed pregnant and requests the care. So, research your rights for yourself, because knowledge is power. Next question. What are the basics on an at-home delivery? How is it accomplished? And what tools are needed? Well, first, you will need to line up a qualified midwife you trust. Second, you will want to plan your space. Where do you want to deliver? What kind of environment do you want? Which room? What kind of birth do you want? Third, who do you want to be present for your birth? And fourth, you'll have to decide if you want to have a doula. Make sure to order your birth kit by at least 32 weeks pregnant, or ask your midwife if she will be supplying the birth kit herself. We'll cover the basics. The basics of a birth kit include various sizes of Chuck's pads, which are absorbent pads with a waterproof bottom. You will need a cord clamp, sterile gloves, bulb syringe, lube jelly, peri bottle, povidone, pads for postpartum, gauze pads. Now this is just a starter list, and as I mentioned before, some midwives will want more or less or different items, so check with your midwife if you are in fact planning an at-home birth. Next question. I was refused prenatal care from a doctor. What do I do next? First, if you ever feel personally victimized by a doctor or hospital facility, My first suggestion is to research your rights in your state in this particular situation, and there is more information available online. Can you sue a doctor or hospital for refusing treatment? The answer is, it depends. State and federal laws vary widely on the issues of medical treatment denial. If you're considering legal action against a doctor or hospital for refusing to treat you or failing to diagnose you, you should consult with an experienced attorney. These cases can be complex, so expect to spend many years on this case and expect the conduct of a detailed, comprehensive investigation, the requirement of hospital records, questioning, and definition of character, as well as supply witnesses and negotiation. Next question. Can your belly really grow without actually being pregnant? And the answer is yes. Your belly can grow without you being pregnant. There are many physical and mental reasons why your abdomen can grow without a growing baby. The reasons are as follows: abdominal tumor, growth, digestive problems, constipation, fecal impaction, megacolon, reproductive issues, parasitic infection, menopause, hormone imbalance, nutrient deficiency, toxin overload, drug use, lack of activity or exercise, depression, inflation practices, phantom pregnancy, mental illness, or a combination of all of these things or some of these things. Next question. Do misdiagnosed miscarriages prove an extended gestational cryptic pregnancy is a possibility? And the answer is not in the least. A misdiagnosed miscarriage has very little to do with a slow-growing baby due to low HCG. A misdiagnosed miscarriage can happen to anyone because miscarriage can happen to any woman. Possible miscarriage is diagnosed with an ultrasound, blood work, physical exam, and history. While an extended gestational cryptic pregnancy, on the other hand, cannot be confirmed by an ultrasound, blood work, or a physical exam. The entire development of the cryptic pregnancy theory was to go around the idea of miscarriage altogether. The possibility of a misdiagnosed miscarriage does very little to prove the occurrence of a cryptic pregnancy because the fantasy of cryptic pregnancy removes the possibility of miscarriage. A cryptic baby is essentially a baby that has survived miscarriage. So again, a misdiagnosed miscarriage does very little to prove the possibility of an extended gestational cryptic pregnancy. Misdiagnosed miscarriage has the word diagnosed in it. Nothing about an extended gestational cryptic pregnancy is diagnosable or even provable. So comparing the two, comparing an extended gestational cryptic pregnancy and a misdiagnosed miscarriage, is like comparing apples and oranges. They are not comparable. Next question. Can stress be the direct cause of miscarriage? And the answer is stress is not the direct cause of miscarriage or a spontaneous abortion. You are not responsible for miscarrying your baby because you were too mad or too sad or too worried or too anxious or too tired. Stress equals emotions and feelings, something you have full control over. Your emotions and feelings have very little influence over the viability of an embryo alone. Therefore, stress is only a contributing factor to a miscarriage and not the only cause of a miscarriage. Next question. I have taken over 10 pregnancy tests. They all came out negative, but I still feel like I could be pregnant. What do I do next? Well, the answer is schedule an appointment with your general practitioner or medical doctor for a blood pregnancy test and physical exam. If the blood results come back negative and you still feel like you could be pregnant, wait a few weeks. Taking an at-home pregnancy test every week until you think you're about 7 to 8 weeks along. At this time, if you have yet to test positive on a at-home pregnancy test and you still feel like you could be pregnant, make another doctor's appointment. When you go in, have them do a full prenatal blood work. Explain to your doctor your symptoms, and don't be afraid to ask directly for an ultrasound for diagnostic purposes. If the doctor doesn't order one themselves, because usually they do. By this time, you should be far enough in your pregnancy, about 8 to 9 weeks gestation, that your growing uterus should be felt during a physical exam, cluing the doctor in, even if you're testing negative, and then probably prompting them to order an ultrasound. If the uterus is not felt, he or she should want to rule out other possibilities and order an abdominal and or pelvic ultrasound to help rule out or make a diagnosis. If the ultrasound is found negative, meaning you are not pregnant, and you still feel like you are pregnant, it is up to you as an individual person and patient to arrange a path for mental, emotional, and physical healing and wellness in either accepting the empty uterus and lack of fetus or not. Next question. I have had several negative ultrasounds, but I cannot shake the feeling. Could I still be pregnant? Answer. If these ultrasounds are performed around at least 6 to 7 weeks gestation and the preceding scans are done after that time frame, then I would say it is safe to accept that you are not pregnant. Next question. One doctor said if the HCG isn't high enough, it will not be picked up on ultrasound. How possible is that? Lately I've been feeling twitching and movement towards my lower back. Answer. We have discussed HCG variation, but it is possible to have a viable pregnancy not be picked up on ultrasound due to the HCG level at the time of the ultrasound is performed. However, this is resolved when an ultrasound is performed further along in the pregnancy as the HCG values rise. The chances of missing a baby on ultrasound at 16 weeks gestation or more due to low HCG is slim to none. Next question. It's pressure like when your period starts and it's just achy. As for the movements, I feel them in my back and my stomach. I've even felt movements against my bladder, and when I feel it, I have to go to the bathroom. What could this be? And is it possible to not see a full-term baby in ultrasound? It is impossible to not see a full-term baby in ultrasound. The movements against your bladder could be due to many things, such as yeast overgrowth, syndrome, cystitis, a bladder infection, parasitic infection, digestive issues, and or muscle spasms due to dehydration, or a combination of all of these problems. Next question. How is cryptic pregnancy different than fetal growth restriction or intrauterine growth restriction? Well, the answer to this question lies in the definition of what a cryptic pregnancy is. It says, cryptic pregnancy equals the lining of the uterus is periodically shed, therefore never allowing the HCG to build up enough to secrete into the blood or urine. In addition, because the HCG never gets completely into the system like a normal pregnancy, the body is not properly signaled to completely support the baby's development. So, cryptic pregnancy is a slow-growing fetus due to hormone imbalance, specifically the hormone HCG. Well, fetal growth restrictions happens in two different ways. It can happen where it's characterized by the head and brain being of normal size, but the abdomen is smaller, or it can be characterized by all the internal organs being reduced in size. Fetal growth restriction is a slow-growing fetus due to hormone imbalance caused by a nutrient deficiency, such as use of drugs, gestational diabetes, umbilical cord abnormalities, or low level of amniotic fluid or placental abnormalities. Intrauterine growth restriction occurs when gas exchange and nutrient delivery to the fetus are not sufficient to allow it to thrive in utero. In other words, slow-growing fetus due to insufficient nutrient delivery caused by a hormone imbalance. So to answer the original question, How is a cryptic pregnancy different than fetal growth restriction or intrauterine growth restriction? And the answer is, it's not. HCG is a hormone. Fetal growth restriction and intrauterine growth restriction can be caused by nutrient deficiency linked by hormone imbalance. Cryptic pregnancy is said to be possible due to a hormone imbalance. There is no discernible difference between a cryptic pregnancy and fetal growth restriction because they are both caused by a hormone imbalance. It does not matter what that particular hormone is. Hormone imbalance is a hormone imbalance regardless of the actual hormone in question, which is linked to nutrient deficiency. So again, fetal growth restriction is essentially the definition of cryptic pregnancy, just in a different context. They are the same. Research fetal growth restriction for yourself and find out how the cryptic pregnancy community rewords medically diagnosable conditions to sound like a totally new type of pregnancy when it's not. So that's all we have for questions or frequently asked questions specific to cryptic pregnancy. I hope this helps somebody. If you have any questions, concerns, please leave them in the comment section below. If you like this video, please give it a thumbs up. And if you want to see future videos, don't forget to subscribe. Thank you guys so much for watching. Have a great day. Be well, be happy. But most importantly, have fun. Bye.